Why has she brought a long sword to go into this patient's spine? When they were trying to leave the room was actually starting to zone in and black out. Is that the sound of my heartbeat? Don't tell me I can hear the sound of my heart beating through my chest. We opened their skull, we cracked open their chest. My body was like, yeah, if you're not gonna leave, we're gonna leave. My consciousness was like, yeah, I don't wanna see this anymore. Is it always that difficult? Am I going to experience this every time I see anything invasive? I want to be a surgeon. My name's Sunny and I'm a third year medical student at Kenton Medway Medical School. And today I'm going to be walking you guys through my first day of third year placement. So let me give you guys a little bit of context about how my medical school is structured in terms of when we have placement, what we do in first and second year, etc. So during first and second year, it's mostly lectures and theory work. But where my school differs is we get quite a lot of clinical exposure during year 1 and 2, but not in a hospital setting. We go through 6 weeks of GP placement during year 1 and year 2. But then in year 3 is when we actually go to hospitals and start our hospital placements. And GP placement is probably as you'd expect it, not very eventful. We sit with the GP whilst they go through their consultations for the day. And actually it's not just with GPs that we sit with, we can sit with nurses, physios, the list goes on. Exposure, but just not in a hospital setting. So I really didn't know what to expect. And by this point, we had just had our induction day at the hospital and they'd given us these green scrubs, which are pretty cool. And rocked up to day 1 of actually having to do stuff, feeling comfortable. I've got my new scrubs, finally made it. This is the reason why I've come to medical school. This is the first time I'm really seeing what the future could look like for me coming to medical school. Up until now, I've just been in lectures, I've just been in a GP, but now I'm actually getting to see what it's like to work in a hospital. And now I'm gonna foreshadow a little bit. This really did not turn out at all like I was expecting. And honestly, no one could have predicted this. Me and my placement partner and we turn up to the ward that we'd been assigned to for the morning, and we turn up, we find the consultant and we introduce ourselves, and then the consultant turns and looks at us and goes, I wasn't expecting you. No one told me that you were coming here. Up until this point in my 2 and a bit years at medical school, whenever the school tells us and go somewhere, someone's always expecting us. Sometimes when you don't even turn up where you're expected, you get a message being like, where are you? Who I thought, so for the consultants to not know who we are, of all people, what's going on here? This is a bit strange. But anyway, she accepts us onto the ward and then straight away she just goes, there's my reg, you can be with them. And then obviously now that I've been on placement and I understand how things work and the consultants are very busy, at the time I was like, wait, I thought we were supposed to be shadowing you, but you're just passing us onto your reg, and I guess we'll go because we can't do anything else about it. But at the time I was like, this is so strange. Anyway, maybe this is how things work, and it turns out that it is how things work. And then after about 1 minute of conversation, the reg asks, so do you guys know how to take histories? And we look at each other like, of course we know how to take histories, that's all we've been doing for the last 2 years. And then she goes, nice, do you know how to examine a patient? And we're like, we do know how to examine a patient. Another thing that's a bit different about my medical school is that we have OSCEs in year 1 and in year 2. And our year 2 OSCE was actually huge. 12 OSCE stations across 2 days. It was a lot. So all of the examinations are fresh in my head at this point. She's like, great, there's a woman in bed 4, go examine her, go take a history, and then come back and report what you find to me. And I'll be honest with you guys, I really don't know what I was expecting placement to be, but it just wasn't this. They don't know who I am, or they weren't expecting me. As soon as they find me, they pass me on to someone else, and we go to that someone else, and straight away they send us out to take a history and examination from someone we've never even met before. We've not been introduced. I don't know how to go up to a patient and just say, hi, can I poke and prod you and ask you some questions, please? Well, I kind of did, but the fact that I'm 5 minutes into the first Monday of placement and I'm already being told to go and examine someone and take history, I was very blown back by this. We take the history, that was good. Our examination, not so good. So then we go back to the reg and we report our findings. And the reg is like, actually, you guys did pretty well. We talk about the case, and then she shows us the blood results for this patient. And one thing I realized, guys, bloods are actually so useful. I couldn't tell you for the life of me what was on those bloods at this moment, but at the time that this happened, when I read the bloods, I was like, that's high, that's low, that's not right. And then the doctor asked me, okay, nice. Why is it high? Why is it low? Why is it not right? And I just looked back at her and I was like, yeah, I actually don't know why it's like that. And then she was like, you remember your physical examination? You remember the signs that you saw? Why were they like that? Actually, we don't know. And it just suddenly struck me that even though I know how to do these examinations and I know what signs to look for, I hadn't yet made the link between what the sign actually means in terms of the pathophysiology and why it's happening. But that was so eye-opening. Coupling that with the explanation through the bloods and how the bloods can very accurately and directly tell you what's going on to this person physiologically, my mind was just blown. My mind was absolutely blown. Wow, this is so interesting. Medicine is just so cool. And even though the introductory process to the day, or even though the start of the day was kind of jarring or unexpected and felt like being thrown into the deep end completely, at this point I was like, I think I could get used to this. This is pretty cool. And just as I was starting to get a little bit comfortable about, I don't know, what placement was going to be like or how this morning session was going, this is when things took a turn. And so after we'd finished discussing this patient, the Reg lets us know that, oh, I've got a procedure to do called a lumbar puncture. And for those of you that don't know what a lumbar puncture is, this is basically a procedure where a doctor or any trained healthcare professional will take a needle and basically insert it through someone's back, in between their vertebrae or around it, or whatever the words say on the screen essentially. And it's to retrieve cerebral spinal fluid, which is fluid that surrounds your spine and brain, to be analysed to see if there's any key findings that would indicate some type of specific pathology, etc. We're like, cool. Never seen a lumbar puncture before, or at least that's what I was thinking. I was like, oh, that's cool, never seen a lumbar puncture before. And the Reg turns to my placement partner and goes, do you want to do it? And then we look at each other and we're like, we don't think our med school insurance covers that, nor are we actually trained to do that at the moment, so no. And then she goes, oh, fair enough. Have you ever seen one before? And then in my head, I was just thinking, how has your question for us to do one come before your question for us to see one? That didn't make sense to me. But we were like, no, actually, we've not seen one before. And then she invites us to come watch. And I was like, sure, I want to see this. At this point, this is probably the most invasive thing that I've ever had the opportunity to watch. And so I was really intrigued to see what it was like. Little did I know, I did not want to see what this is actually like. So fast forward to when the doctor was actually completing the procedure, and she does this thing called the aseptic technique, which is when you clean your hands, you clean your area, you make sure the patient is adequately exposed, and then you aseptically, which is like without breaking the sterile field, put on your gloves, you get your instruments ready. Nice, that bit tick. Then she applies local anesthetic to the patient by injecting lidocaine around the area which she was planning on putting the needle through. That goes fine. And having spoken to the patient a little bit, the patient had had this procedure before, and the doctor's obviously done this procedure before, so I was thinking, oh, this is going to go smoothly, it's a run-of-the-mill procedure, this isn't new to anyone, nice. Boy, was I wrong. This is the first bit where I was like, what have I gotten myself into? So the local anesthetic has now, it's activated, the patient is now numb in the correct area. And obviously we've learned and heard about lumbar punctures in our lectures when we're studying things like neurology, because how else are you going to assess the brain for physical damage or infections about studying the fluid that comes from there. So we know of lumbar punctures, but we have, because we've not been taught how to do one, I don't know the landmarks or the specific cues and directions to find the right place to inject the patient. So I'm not really watching for this. Looking back, this is something really important. The doctor then gets out the needle, which is to be used for this procedure. And oh my God, guys, when I see this needle, I promise you, I was like, why has she brought a long sword to go into this patient's spine? I'm telling you, it was this wide. It was so long. I've never seen a needle this big. After speaking to one of the doctors that work in medical school, they were like, oh, the needle was no more than 10 centimeters. I don't know if this is the fear My mind playing tricks on me, but I promise you guys, in my head right now, I'm seeing a needle that is at least 20 centimeters long, if not 30. And I was like, wow, that's a big needle. And the doctor just continues. She attaches the needle to the syringe, and then she lets the patient know that she's about to inject the needle, and the patient's like, that's cool, let's go. Then the needle punctures the skin, it goes in, and then it gets stuck. And then the doctor's like, oh, we're in the wrong place. She draws it out a little bit, and then pushes forward again. Then it gets stuck again. And then she keeps attempting to go in and out and to get into the right position so she can draw up the fluid. Whilst this is happening, the patient is wincing, they're twitching, and oh, honestly, it just made my skin crawl. I want to be a surgeon. I love procedural medicine. I feel like being a pure medic and just giving medication to a patient and then seeing what happens, it's not really for me. I want procedures because you can just get things done, see an improvement there and then. With this in mind, I'm watching this happening here, and at this point, I'll be honest, my sympathetic nervous system is activating. The temperature in this room, I promise you, is increasing. It's a heavy 28 degrees and I'm not feeling comfortable anymore. So this goes on for what felt like ages. My memory is so impaired by how uncomfortable I felt in this situation that if I told you how long it took, this could make it sound like the doctor was doing a terrible job, but she really could have just been doing a fine job. But at this point, I'm starting to like not pay as much attention because I'm starting to feel uncomfortable. And I look at my placement partner. I don't know for how long, but my placement partner was just not looking at all. Their head was completely turned to the side. They were like, this is too much for me. And I don't blame them, to be honest. When I saw that, I was like, fair enough, because I'm not someone who gets squeamish. I don't mind blood. I don't mind vomit, I don't mind big open wounds, but if I'm starting to feel uncomfortable, I'm really not surprised if other people are starting to feel uncomfortable. Hospitals are usually multi-stories, as you'd imagine, and there was a floor above us. Obviously, if there's a floor above you, then people will be walking around. Whilst this is going on, all me and my partner, or I guess everyone here is just thudding from upstairs. And I can't lie, at first I was like, is that the sound of my heartbeat? Don't tell me I can hear the sound of my heart beating through my chest right now. And then I quickly realized, no, it's not my heart. It can't be my heart. It's the people above me. Funnily enough, my placement partner thought that this was their heart. And this was their cue that the end is near. So after they concluded that they'd had enough and that they thought they could hear their heart beating, they just made an exit for the door. And then after we talked, they were telling me that when they were trying to leave the room was actually starting to zone in and black out. So they were definitely fight or flight mode, completely activated, body's about to power off. And at this point, I was like, wow, should I go with them? But I was like, no, this has to finish soon. I was like, no, I can get through this. So I did, I stayed there. And at this point, the doctor was like, let's change needle. And again, I couldn't tell you how long they were trying for, but many attempts going in and out and just being denied access every single time. What was really getting to me was the patient wincing and twitching, because something about seeing someone else really uncomfortable just really pulls at your emotions, because I'm no stranger to scalpels and open chests and anything like that, because through year 1 and 2, we were doing cadaveric dissections. Our group had a cadaver and we opened their skull, we cracked open their chest, we peeled back layers of the leg muscles. So I'm not a squeamish person, but something about seeing another person in pain, I just cannot do that. Throughout this whole experience, a thought in the back of my head, I want to be a surgeon. If I can't sit through this, then what hope do I have? Really and truly, if I want to be a surgeon and I can't watch this, I'm cooked. What am I going to do? So part of me wanted to finish this just so I could actually see what happens at the end of the lumbar puncture. But another part of me was like, nah, Sonny, if you want to be a surgeon, you should be able to watch this. And so that was kind of my pride kicking in. I'll be honest there. Time went on and the second needle, the doctor was still attempting, but they could just not get it. And so after the second attempt failed, I was like, oh, they're probably going to stop now because we've tried twice. The patient's not very comfortable. Probably reconvene for another time whenever is most convenient for everyone in the room. Yes? No. The doctor gets out a third needle. This was when in my head I was starting to lose it. Are you kidding me? Are you serious? Are you actually serious? First of all, where did the doctor get all these needles from? I'm just seeing them appear. You can't tell me these lumbar puncture packets come with 3 needles. They're expecting every time the procedure to not go well to the point where using 3 needles is standard. I do not believe that at all. And that's the point where I'd had enough. The doctor whipped out the 3rd needle and I was like, you know what, guys, let's call it a day, or at least I'm going to call it a day. And I make a swift exit for the door. At this point, which was actually perfect timing, because at this point my body was like, if you're not going to leave, we're going to leave. My consciousness was like, yeah, I don't want to see this anymore. And I promise you, as soon as I leave the door, my fight or flight response really kicked in. The adrenaline, the sudden rush. I was kind of dizzy. I sit down on the nearest chair I can find and beads of sweat just start forming on my forearm in front of me. My heart is pounding. And I was like, wow, good thing I got out when I did, because a week ago I just collapsed after running a half marathon. Don't worry guys, that story is coming as well. But I was like, I'm not trying to collapse again for a long time, I'll be honest. But yeah, the adrenaline was coursing through my veins and all I could think of is, wow, that was tough. That was difficult. Is it always that difficult? Am I going to experience this every time I see anything invasive? I hope not, because my surgery rotation is right at the end of my year and I want to be a surgeon, I can't lie. So I was really hoping that this was not going to be something that was a reoccurring thing. Hopefully this was just a beginner thing, you know? Eventually I calmed down. Looking back at it, I didn't even think about where my placement partner was at this time. And then I just see them walking back from the toilets and then they're like, I had to get out of there. And they said seeing me not in there or having left as well before the procedure was finished actually kind of reassured them that they weren't being, not being too soft for leaving a procedure that they couldn't kind of stomach. And I kind of want to relay that message. Guys, if you feel uncomfortable and feel like you need to leave a situation or a procedure or a consultation, do not think that it makes you any less of a medical student or a healthcare professional or whatever, because it doesn't. Number 1 priority is your safety. So if you don't feel comfortable, you need to leave, because you might just cause more damage to the things around you or the people around you or even yourself. So it doesn't make you weak or anything. Don't think that. But yeah, we have a little debrief about what we just witnessed, and a nurse who was working on that ward also saw that we were both kind of shaken up, and she gave us some orange juice, and I thought that was really nice of her. By the point we finished our orange juice, it was 11:30 and an hour later, so we had to go into teaching. And so that was the end of my first day of placement, and I was just like, what the flip happened there? We honestly went into teaching as if nothing happened. But no, definitely a character building experience, and safe to say I was expecting anything and everything after that first day, to the point where now things are almost less interesting because it's like, well, I'm not getting that same kind of buzz, you know? Well, arguably, since then I have watched some equally invasive stuff. I've seen a few chest drains, I've seen a few pleuritic drains, I've seen a few ascitic drains, but like I said, I've not actually been onto surgery yet. And I've been in the cath lab, I've seen a few stentings for coronary diseases. I've not revisited the lumbar puncture, but that is a villain I will revisit one day. And those other experiences which I have seen now, they were definitely stomached a bit better. I'll be honest, I still wasn't completely comfortable, but I feel like there's a big difference between watching something being done and actually doing something yourself. Because when you do procedural things yourself, it's like you just zone into the task. Obviously, it always matters how the patient is feeling, because if they're in pain or distress, then you can't really do a good job. But in a way, you dissociate from the fact that you're doing this to a person and the objective is to complete the task. And so you're not too worried about how the patient is feeling at the same time, because obviously this is going to be uncomfortable. But I feel like you're less worried about that because you've got the bigger issue of doing this safely. And I feel like when you're watching, you don't have that distraction. So it can come more to the surface and manifest itself in discomfort. But we're working on it, definitely getting more comfortable. And so I hope you guys found my first day of placement story entertaining. I didn't find it that entertaining. I found it quite scary to actually live through, but I will see you guys in the next video. Leave a comment down below if you've ever experienced something like this, or if you've ever gone into a day at school or at uni or on placement expecting one thing and then finding out it's completely not what you've expected at all. I'd like to hear about that. I'll catch you guys in the next video. Peace.